Neglected tropical diseases. What are neglected tropical diseases? Neglected tropical diseases, or NTDs, is an umbrella term used to describe a group of communicable diseases that affect over 1.7 billion people. NTDs cause immeasurable suffering. They debilitate, disfigure, and can be fatal. By most commonly affecting some of the most vulnerable people in the world, who often live in remote communities, NTDs create cycles of poverty and cost developing nations billions of dollars every year. Neglected tropical diseases are a group of preventable and treatable diseases that place a heavy burden on over 1.7 billion people around the world. Almost all countries are endemic for at least one NTD. Over 1.7 billion people are affected by NTDs. Some countries are endemic for more than 7 NTDs, such as Brazil, Democratic Republic of Congo, Ethiopia, Kenya, Nigeria, South Sudan, Tanzania, Uganda, and others. The following picture demonstrates the number of NTDs endemic per country. There are currently 20 diseases defined as NTDs, which are the focus of the World Health Organization, or WHO's, roadmap. These 20 include 3 diseases that have been recently classified as NTDs: mycetoma, scabies, and snakebite envenoming, which combined kill more than 200,000 people every year. The 20 NTDs are: number 1, bilharzia, or schistosomiasis, blinding trachoma, Buruli ulcer, Chagas disease, dengue and chikungunya, echinocochosis, elephantiasis or lymphatic filariasis, foodborne trichomoniasis, kidney worm disease, intestinal worms or soil-transmitted helminths, leprosy, mycetoma, rabies, river blindness or onchocerciasis, scabies, sleeping sickness, snakebite envenoming, taniasis and cysticercosis, visceral leishmaniasis, and yaws. The World Health Organization is ending the neglect to attain the Sustainable Development Goals. Roadmap for Neglected Tropical Diseases 2021 to 2030 describes 5 broad NTD interventions with the aim of controlling, preventing, and/or eliminating 20 NTDs. The 5 interventions recommended by the World Health Organization to combat neglected tropical diseases are: number 1, preventive chemotherapy and transmission control, or PCT. This intervention focuses on the availability of safe and effective drugs, which make it feasible to implement large-scale preventive chemotherapy. Number 2, innovative and intensified disease management, or IDM. The goal of IDM interventions is to manage diseases within primary healthcare systems, and ultimately to eliminate those diseases as public health problems. This intervention is used when cost-effective control tools do not exist and where large-scale use of tools is limited. Number 3, vector ecology and management. Vector management focuses on effective methods of targeting mosquitoes, flies, ticks, bugs, and other vectors that transmit pathogens. Number 4, safe water, sanitation, and hygiene, or WASH. Access to safe water, adequate sanitation, and hygiene is a key intervention in the new World Health Organization draft roadmap. It is critical in the prevention and provision of care for all NTDs. According to the latest data, 40% of the world's population does not have access to hand-washing facilities at home, 47% of schools lack hand-washing facilities, and 16% of healthcare facilities have no functioning toilets or hand-washing facilities at points of care where patients are treated. And finally, number 5, veterinary public health services. This intervention recognizes that the health of people is connected to the health of animals and the environment in which people live. Many NTDs, such as rabies, are zoonotic diseases that are transmitted from animals to humans.